Good afternoon, everybody. My name is Dr. Lieutenant Colonel P. Prabhakar. I am the Associate Clinical Director and Head of the Department Orthopaedics, Care Hospital, Nampally. Today we'll be speaking a little bit about hip arthritis, primarily the secondary arthritis of the hip. Now we do know that as we tend to age, there is some amount of degeneration which continues to occur in almost all joints. Now this is particularly accelerated in the joints of the lower limb, which is primarily the weight-bearing areas, which is the hip and the knee. The knee, of course, is much more common in terms of degeneration as the forces across the knee joint tend to be higher. However, we do see a large chunk of hip arthritic patients too, which is that the cartilage involving the hip joint also tends to wear. Now, this can be secondary to many conditions. Primarily, if in case there is some kind of a childhood onslaught, for example, Perthes disease, which has led to some degeneration of the cartilage, and subsequently these present to us with secondary arthritis. It can also be a post-traumatic situation wherein people who have sustained fractures or perhaps other complex injuries in the form of acetabular fractures tend to have their joints which are deranged and therefore also predisposed to early wear. The third entity which has emerged post-COVID has also been the advent of avascular necrosis following therapy of sometimes very high doses of steroids and sometimes not so high, but nevertheless, we have seen a huge chunk of population which have presented to us with secondary arthritis, specifically avascular necrosis following post-COVID treatment therapy. So when we look at all of these things, in younger individuals, the treatment protocol definitely needs to be assessed carefully before we offer them surgery. There are options in terms of an avascular necrosis scenario, wherein we tend to do something known as core decompression, which tends to relieve the intraosseous pressure and also creates a channel, if you will, of blood flow to the affected area. This combined with BMAC, which is bone marrow aspiration concentrate, is also a procedure which has found very good results, and we have a series of cases we have treated with this, and we have found significantly good results with this particular therapy. However, having said all this, this is reserved for individuals wherein the stage of arthritis is limited to up to 2 to 2B. Once we have more advanced stages of hip arthritis, these tend not to respond to this kind of therapy. The literature perhaps suggests that the success rate is anywhere between 43 to 47%. So in these individuals, if especially they are younger individuals wherein quality of life is important, surgical options need to be explored. The most common surgery, once there is established bone-on-bone contact or very severe advanced form of arthritis, would mean that we will need to offer them the options of a total hip replacement. In a younger individual, we tend to give bearing surfaces which are longer lasting, which may be either metal on poly or ceramic on ceramic options, which have a survivability of about 30 to 35 years. Now, these tend to be stable and these tend to offer a good quality of life for the individuals so that they can lead a normal life. However, all of these decisions need to be arrived at following careful X-ray examination, clinical examination, and all of these combined with the demands and requirements of the patient. So, it is advised that one should consult an orthopedic surgeon and discuss with him regarding your apprehensions, your expectations, and so on before you opt for a surgical option. Thank you.